Hi guys, today I'm with Dr. Tracey and we're going to talk about one of the most popular treatment. Guess what it is? Yes, you are not wrong, it is a lip filler. Tracey, lip filler has so myth and PR around it, and it's probably one of the most searchable term in Google when it comes to injectable treatments. What do you think when you hear about lip fillers? What is the first thought that's come in your head?
Well, I'm going to talk from my own experience and thoughts. I think if I were someone who's never had lip fillers before, I would definitely wonder, is it painful?
Well, that is a very good question. Lips is a very sensitive area and it's quite vascular area, so it could be painful when it's done wrong. But what experienced practitioner will do, so first of all, practitioner has excellent technique, and with a good technique pain will be minimal. Secondly, practitioner have a different tools to minimize this pain, so we can either apply topical cream, or what I often apply in my practice, I give my patient a dental anesthetic, so they are fully numb and therefore they don't experience any pain during the treatment.
That's really good news.
So then that makes me much more comfortable as some newcomers for this lip filler. So the next question, if I were a patient, would be, how much am I supposed to have?
Again, this is a very good question because we hear about 0.5 ml, 2 mils. So it all depends on your natural lips and initial lip condition. So if you have a very small lips, it probably will be the case where we will build it up in stages. We might start with 0.5 ml or probably 1 ml, and then we might need to add more product, but at completely separate visits. Allow the first set of product to settle, make sure that it's everything nice, smooth. The worst what could happen to put too much product straight away, but my recommendation would be generally if you want to have a natural and noticeable lip transformation, anything between 1 or 2 mils in 2 visits is a good amount to work with.
Lip transformation, that's a really good word, I like it. So I'm wondering then, can I transform my lip to just, for example, like this lady's lip? I really like her lips, it's so symmetrical, so sexy. Probably Angelina Jolie's lip.
Well, Tracey, I really like the flow of your thoughts, but however, you are not Angelina Jolie, you are beautiful Tracey, and Tracey has a beautiful lips that suits her face. So unfortunately guys, the news is and the truth is we can't put Angelina Jolie or Kylie Jenner lips on everyone's face. We can make your lips most beautiful and most suited to your facial proportion. So the answer is no, we can't made a lip filler by choice, and certainly not like put celebrity brand name on it.
That's a much clearer explanation. I see. I think I can accept that just enhancement to my lips is probably what suits me. So the next question is it expensive to do it with you? I know you're really good professionals. If lip filler is so common, can I go to someone who offers cheaper price?
My advice will be never be guided by the price. So you always get what you pay for. When the price is too cheap to be true, it's always the case. So it's either unexperienced practitioner or some compromised product. There are, I think, nearly 200 different brands of filler in the UK. They are not regulated and new filler brands come and goes, but you will stay with those awful lips if you go to the wrong practitioner. So I would say never be guided or lead by the price. Go by personal recommendation, practitioner experience, qualification, and always ask to see their before and after photographs.
That is so true. So I think we've all heard about some negative news coming from lip fillers, haven't we? So I'm just wondering, how safe is this procedure?
And the true fact that I would say lips probably one of the most dangerous cosmetic treatments, because when we hear about complication, it's always lips. And also what I try very hard to understand, every practitioner trying to compete and offer a lot of lip filler treatments to the patient, and practitioner, regardless of their experience, they want to start their aesthetic journey from the lips. But lips is one of the hardest area to treat anatomically wise, because this area is very mobile, with very expressive. Products tend to migrate in this area. The placement needs to be absolutely accurate, and also as we already spoke, lips could swell, they could bruise, they could be quite uncomfortable if not there is bad technique or there is no right anesthetic applied. So I would say it's not the safest area to have treatment. However, as always, I would like to highlight, if you go to experienced practitioner, to medically qualified practitioner, you are in the safe hands and you can have your lip filler done with confidence.
That's really good news. So I think I can't agree more with you on that lip filler advanced treatment rather than just a beginner treatment for any practitioner.
Absolutely, absolutely.
Just like when we're training people, we wouldn't encourage the medical professionals to go away, inject lips just after a one-day training.
Absolutely not, absolutely not. Tracy, and I wanted to ask you a question. We spoke about different trends and celebrity trends, but what's your opinion about like Hollywood lips, Russian lips, New York lips? What do you think about those?
So again, I don't think, first of all, I don't think it's correct to put lip shapes as a menu for people to choose, because you might not be suitable for the one you like. So again, those are just the commercial names that's made up by the marketing business, which is not entirely down to professional reasons. So I would still, even if you think you want to enhance your lips towards that way, still come in for a thorough consultation rather than just go for those names, which is very dangerous, sometimes not responsible for yourself.
Absolutely. Well guys, I hope that you received our message. Always go to medically qualified, experienced practitioner and never be led by the price alone.